Hi, my name is Courtney Buck, and today I'm going to be doing part 2 of the medication experience. So we're giving medication to Millie Larson again. I'm going to come to her AMR, note her name, her date of birth, January 1st, 1936, her medical record number, and just double check and she has no known allergies. So medications scheduled right now are Lasix, 20 milligrams, IV push, which she'll receive every 12 hours, administered over 2 minutes with a 3 ml flush before and after, and insulin Lispro, 10 units subcutaneously with her breakfast. So first I'm going to drop her Lasix, and I've got furosemide, 10 milligrams in 1 ml. Double check the expiration date, which is 10/29. And I performed hand hygiene before I get started. And take my 3 ml syringe. Today, just to draw it up, I'm using a hypodermic safety needle. It's a 23 gauge 1 inch. Now my hands are all slippery. Alright, so she is getting 20 milligrams. And it's 10 milligrams per ml, so she's going to get 2 mLs. Pull this back. First I'm going to clean it up. Air bubbles. Safely recap that. And now I'm just going to label it. So it's Lasix, 20 milligrams. Set that to the side. Now we're going to drop her insulin. So I'm going to take the insulin Lispro. Clean the top. I'm using a normal insulin syringe, which is a 1 ml 29 gauge ½ inch. I'm going to pull back the 10 mLs. Alright, again, before I go to Millie's room, I'm just going to do a double check. So I've got Lasix, 20 milligrams, then 2 mLs. And then double check her insulin, and it's 10 units. 10 units. All right, now I will bring these to her room. So we're in Millie's room. I'm going to perform hand hygiene. Introduce myself. I'll ask Millie what her name and date of birth is. Millie Larson, January 1st, 1936. I'm going to double check that on her wristband, and then as she's telling me, and then from her wristband, I will also double check it in the MAR. Just verify she still has no known allergies, and explain to her the procedures. So I'm going to give one of her medications in the saline lock in her arm, and that's for Lasix, and she's getting it for to treat edema and her blood pressure. And then let her know that I do have to give a subcutaneous injection. It'll probably be at, I can give it in either the back of her arm or in her abdomen. I usually like to let my patients decide. And let her know that that's with her breakfast for controlling her blood sugar. So I'm going to start with her Lasix. Look at her arm here. Perform some hand hygiene. I'm going to get my normal saline ready. It's going to pop out at me. Anyway. Put on my gloves. Anytime that you're administering something IV, you always want to clean the hub for about 15 seconds. Okay, get these in order. So first I'm going to give her a 3 ml flush for the IV. I just want to pull back a little bit to make sure it's patent. Let me give her 3 mLs. And while I am giving her these 3 mLs, I want to check for, the word is escaping me, just to make sure that that there's no pooling around the site, no redness or anything like that. Infiltration, that is the word. So there's her flush. And give her medication. And the Lasix is going to be pushed over 2 minutes. Which is going to be pushed over 2 minutes for sake of time. I'm just going to put it in. While I am giving her the Lasix, I want to make sure that she's not experiencing any discomfort. Sometimes some medications putting in IV can burn. But I will sit here and push that over 2 minutes. And then I'm going to flush again. With 3 mLs. So that is all set. Now I'm going to remove these gloves. I'm going to go ahead and get ready to give her insulin. So perform hand hygiene again. So for right now, I'm going to be giving this insulin in her right lower quadrant. She chose abdomen. Put a new pair of gloves on. Alright, for demonstration, I'm going to use this orange. So I have the insulin here. I'm going to clean the site. For insulin injections, you go in, so I'll pinch the subcutaneous tissue. You go in at a 45-degree angle. So there's going to be a little poke. Hold it there for a couple of seconds just to make sure that the medication doesn't seep out when you remove the needle. And take the, like it just did, and take the needle out, cap it, put it in the sharps container. If she needs, I'll give her a Band-Aid. That'll be all set. So before I leave her room, I'll make sure that she's comfortable, make sure that she doesn't have any other needs. All of her belongings, her collet and everything is all within her reach. And that would be it. So after I gave her the medications, I'm going to come back to her MAR. Put on here the Lasix was given. And the insulin was given. Insulin was given in the right lower quadrant. So for site, I'm going to go over here and put a K. And then sign it out at the bottom. Yeah.